And joining us now is epidemiologist Dr. Wong. He is also the Senior Technical Advisor of public health research firm EpiMetrics. Good morning, Dr. Wong, and thank you for joining us.
Good morning, Ria. Thanks for having me.
Now, Doctor, do you think this slight increase of cases is any cause for concern?
Yeah, it's true. No? There's been a slight increase in cases. No? In fact, the rate of decline over the past 4 days has decreased by about 10%. No? The decline is slowing down. I think it should be concerning, no? Because we have made a lot of gains, no? Over the past 2.5 months, and we need to preserve those gains. No? There are two ways with which we can sustain these gains. No? One is increasing the fairness, no, and the level of vaccination coverage. Right now, we need to protect the elderly, no, because only 60% are protected, no, and we know that over the past 18 months of the pandemic, no, 80% of deaths are among people 50 years and above, no. So right now we have about 12 regions whose elderly vaccination rate is still below the national average. Second, we have to protect the unvaccinated. No, 70% of Filipinos are still unvaccinated. A while ago, you were talking about boosters. No, but if our goal is to prevent hospitalizations, no, actually vaccinating the unvaccinated is 5 times more effective, no, in preventing hospitalizations than giving boosters to those who are already vaccinated. And finally, you know, we need more geographic equity also. No? About 13 regions, no, in the country are below the national average, no, in terms of vaccine coverage rate. The other thing we need to do, no, to sustain the gains of the past 2.5 months is as more people move indoors, no, for work, to go to restaurants or to malls, no. In fact, from Google Mobility Trends, we've seen 45 to 90% increase, no, in the number of people in indoor settings, no. To counterbalance this increased crowding, no, we have to improve ventilation. About 2 weeks ago, no, I went to a mall, no, with my portable carbon dioxide sensor. Carbon dioxide is a good measure of ventilation. No? It should be less than 1,000 parts per million. No? I was able to measure from between 400, which is good, but sometimes I get values of 1,000 to 2,004. No? So we need to improve ventilation. No? And this should be a joint effort of government, business, and the public also.
Right. Well, projections are saying that the trend of cases is going downwards in general. But why are we seeing the cases going up? To what can we attribute this? Is it because of late submission of figures, or is it because simply more Filipinos are out and about and interacting?
Well, if we look at very short periods, no, we will see a lot of noise, no, or variability in the cases, no, because of late reporting, no? But it's more useful to look at long-term trends. No? That's why we also report, or we also use the indicator of 2-week growth rates, no? Because it averages over longer periods. No?
Right, so we probably need to wait a little while. But what else can be done to prevent a surge of cases during the holidays? I mean, as you said, you were out in the malls, and I'm sure you saw it. It's much, much more crowded than we've seen it in the past 20 months.
So the two things are, first, to improve indoor ventilation rates, no? And the second is to increase our vaccination coverage rates, no? Not just in the NCR, no, but especially in the 13 regions where the vaccination rates are lower than the national average.
Right, so just to get more people vaccinated, and you're saying to prioritize people who are completely unvaccinated over those who require boosters.
And also the elderly.
Right, okay, thank you so much for that. We appreciate your time, Dr. Wong, for joining us here this morning on New Day.